Good morning, everyone. My name is Mary Lauby. I'm the Adult Injury Prevention Coordinator for UW Health and the Level 1 Adult Trauma Center. Welcome to the UW Health Trauma Awareness Month Injury Prevention Series. Today, I'm very pleased to have one of our community partners with us from Focused Interruption, and that is Anthony Cooper and Nick Loumos, and I'm going to ask them to introduce themselves before we get started.
Good morning, everyone. My name is Anthony Cooper. I'm the CEO for Focused Interruption in Dane County.
Morning, everyone. Nick Loumos, COO of Focused Interruption.
So let's start off by having you tell us just a little bit about Focused Interruption and the work you do there.
As CEO at Focused Interruption, and I'm pretty much, we have now been around since 2016, and our main focus is to be able to ending and preventing community gun violence in the Madison and Dane County area. We pretty much formed a collaborative among different organizations in the community, ourselves, and also to being able to end gun violence in our community. So as you will see here, as far as when we talk about our mission, it is to use holistic approach to reduce generational trauma by providing evidence-based intervention and prevention services to people, neighborhoods, and families most impacted by gun violence. Our vision is to ensure every neighborhood and family at high risk of gun violence in the Madison area has access to innovative evidence-based community gun violence prevention and programming. Since 2016, a team of violence interrupters with lived experience have been responding to the scenes of violent incidents at the UW hospital in the communities, mainly, but also at the UW hospital emergency department when contacted by law enforcement, UW hospital staff when a shooting occurs. We also respond to the scenes out in the community as well to be able to help navigate those situations also. One of the things, excuse me, as you will see here, is that, we have the community connections, but also being able to navigate the systems through the hospital, as well as with law enforcement. Our main approach to all of this is it takes a community to be able to reduce violence. So that means everyone is included. This is just kind of points out one of the ways how we're able to make a difference and who our partners are in the community. We have Public Health, Nehemiah, UW, Days, Rainbow Project, Rape Crisis Center, City of Madison, Madison Police, Madison Community Foundations, and also, I'm sorry, I did not, and also I cannot leave out Dane County. Again, this is really just kind of talks to the effort that we all have to put in to be able to reduce violence. We all have our individual approaches, but again, it takes a community. It takes not only these institutions, but then also being able to connect with different organizations throughout the Dane County area as well.
So Anthony, can you just say a little more about how those partnerships work and examples of how you work together, or Nick, either one of you or both of you?
So one, there's a couple of different ways of how these partnerships work. One is being able to see the different resources and ways on how we can approach different situations that are happening in our community. So for instance, we may, I'll use domestic violence for one. That's an area of violence, but with our partner Days, we're able to call them and look at ways how they can assist And then also they would look at ways how we can assist them as well. Similar to, and even if we talk about another one of our partners, Rainbow Project. Rainbow Project is also an agency that who we can refer into, and also they refer back to us as well. And we find different ways of being able to build strategies to help families in crisis. Public health, being able to help us with the data, but then also our partners, even with Madison Police, there's certain things that they know, because we do not work for law enforcement, but there's certain things that they know that they can either say, hey, you know what, maybe if you all can either nudge this family or nudge this this person to be able to talk to them, because we don't, if they may hear, or even they may hear more violence may occur, we're able to at least be able, with the hope of being able to step in front of that and being able to find other ways to be able to come up with solutions for that individual. If those things don't work, of course, law enforcement, they do their job. That's their job, to protect and serve the community. We kind of come in as a way to be able to look at different strategies to prevent more violence from happening in our community. And similar to Dane County and also the city of Madison, being able to, of course, City of Madison, we do receive funding from City of Madison and also some funding from Dane County, and also in both arenas, being able to have different conversations to be able to build on what we need, what we may need to support our communities that who are in crisis.
That's great. And I'm aware that Public Health, Madison-Dane County just came out with a very ambitious strategic plan for ending violence in the community. Can you talk about your role either in the development of that? There seem to be many partners involved with that initiative. How do you see that helping guide the work that you're doing?
So I would say, so we have a group that's called CSET, where we're able to with some of those partners that I've already mentioned are a part of those meetings, and being able to not only kind of strategize to look at ways how we can come together, whether if it's helping a family out there who is in crisis, or trying to find different ways to provide additional support. And support comes in an array of different ways. So that's one thing, but also we're with our CSW workers, and I'm pretty sure Nick will talk a little bit more about that. That's our community safety workers who are currently working in the Raymond Road area, in the Raymond Road area, are able to really kind of not only dive in, but also kind of tackle some of the low risk. Instead of being able to have police respond, we actually have our CSW responds in collaboration with MPD. And this, instead of this being a ticket, we try to find out other ways of negotiating, either in that low incident of crime, to be able to help navigate different situations that way. Because again, if you may have certain families that are unable to be able to pay off $100, $200 ticket for whatever the case may be, or have this infraction on their record, on the CCAP record, this is a way to being able to prevent those things from happening if it's possible. And again, that ties into public health. It's also being able to, public health, and also, and I must talk about our partners with Madison Police and the West District Captain Kim Tim Patton. So Nick, I don't know if you don't mind kind of starting off. I feel like, so I don't want to take up all the time, but when we talk about why we do this work, Nick, if you don't mind starting, I'll end from there.
Sure. I do this work because I believe in a very deep level that human life matters above all else. I do this work for the same reason I would do CPR on someone if they fell down next to me with a heart attack, or the same reason I would run over to someone and put pressure on a wound if they were shot next to me. These are our neighbors, these are our friends, these are our coworkers, these are our community members. I have the skills and the wills to do something about this issue in my home. And so I'm dedicated to doing what I can.
Yep.
So
Go ahead. I'm sorry, Mary.
you go ahead, Anthony.
Oh, yep. And so, and I'll add on to that as far as why I do this work, by being someone who's been impacted by gun violence, but then also the fact that I believe in our community, and similar to what Nick had just mentioned, as far as being able, one, I understand it takes a community to be able to approach gun violence, and knowing that all of our approaches are different. And so willing to always being able to not only be there, but then also being able to put a patch with the hope of being able to making sure that people are being cured from gun violence, and also that we're really attacking the trauma that goes behind gun violence as well.
So would one of you like to just tell us a little more about James's story and why this is a good example of the work you do and the work of your outreach workers?
Sure, I can touch on that. So this is an example of a successful intervention from an outreach program. So outreach programming is essentially like case management and mentoring for people at highest risk of community gun violence victimization and perpetration, usually carried out by people with lived experience with violence in the criminal justice system. So in this example, James' brother was murdered last November, and our outreach worker, Jerome, who's also one of the founding members of Focus Interruption, had a relationship with both James and his brother for the past few years. As a mentor and a coach and kind of an outreach worker doing his job. And so when James found out that his brother was murdered, he understandably wanted revenge, wanted retaliation. He wanted to go find who did it and shoot them. So he was in prison at the time, but he was getting out within a few weeks or months of the murder. And Jerome reached out to him while he was still inside and was able to continue to connect with him and talk with him and help him understand that is not what is best for him and his family. James has a couple small children. James listened and wanted a different life and wanted to go a different direction. So when he came home, Jerome picked him up and worked with him to help him get a job. As you can see here, James is now working 12 hours a day, taking care of his family. He's got a good job, it's well paying, and he meets with Jerome regularly. James, at some point, James just decided that he wanted a different life, and we were able to meet him at that moment with the supports and the resources necessary to help him walk that path. And that's the key. It's key to understand that the people caught up in these violence dynamics is very, very difficult to break out of, and potentially lethal to try to break out of without help and without support. So to be able to meet someone who's ready to make that change, but also meet them with the supports and the services necessary is essential. So that's what our outreach program seeks to do, and this is a textbook example of a successful outreach intervention.
So it sounds like that is a great segue to talking about what I hear the two of you talk about all the time, and for which we at UW Health are very grateful, because as a community partner, I know all of my colleagues who you work with are truly grateful for the work you do at the hospital and with patients and their families. So Tell us a little more about ending gun violence.
Sure. So when we talk about ending gun violence, first of all, to my knowledge, it has never really been ended in a given city in the US. So some might say that it's a pipe dream that can't happen. However, I would argue that the first ingredient to successfully ending gun violence in your community is to believe that it can be done. And I don't think it's outside of the realm of possibility for several reasons. One, the interventions, and you see them listed here, that we know work, that can see upwards of 60% reductions in community gun violence, have never been scaled, have never been funded to scale. So we know we have these things that are working, that are having significant impacts across the country for the past 30 years, but they've never been funded to scale, and they've never been institutionalized, and they never kind of really embedded themselves in the institutions in a given community for the long term. So I wonder, and I believe that if we implement what works, if we do what works and we build on it, I really believe that we can end that here. This is a breakdown of, and when we talk about a community, it takes a community to prevent gun violence. What do we really mean by that? What we really mean is an ecosystem of proven methods focused on people at highest risk of community gun violence victimization or perpetration. These four: street outreach, hospital-based violence intervention programming, cognitive behavioral therapy, and focused deterrence, are the four methods that are pretty much the essential ingredients for a successful ecosystem. And finding out a way to implement, systematize, and institutionalize these four things, funding them to scale, is the way forward.
Can you just, so street outreach, you've talked a little bit about that. Hospital-based intervention programs, I know you're doing some of that work now with UW Hospital and moving on to St. Mary's, right? And possibly Moderator. So of these four things, what are you doing now to the degree you feel like you need to? And and what else needs to happen? Do you need to expand on these things? Do you need to develop these things? Are some of them not yet in place?
So some of them, I mean, of course, it always starts with a vision and being able to collaborate and bringing the right people in the room and being able to have the appropriate conversations and being able to say, okay, hey, this is what's necessary. One of the things, as Nick also just mentioned, is as far as by understanding what works and actually working and actually doing it. Focus Interruption, it went from a thought to actually, hey, this is something that what we have to do. It's now been just about going on 5 years. And so it is now, it's the same thing with the hospital relationships and police department relationships, community relationships, being able to pull people in to be able to understand and say, hey, this is what we have to do to be able to defuse and change what violence looks like in our community. And this is something that we cannot keep putting it to the wayside. And so, as not only are we making the relationships happen, but also our plan is to being able to expand our team even more throughout Madison. I'm sorry, I shouldn't say Madison, but throughout the Dane County area, because it's necessary to make sure that we all have a clear understanding of not only the violence that's going on in our community, but then also the ways how we can address the violence that goes on in our community to make sure that it doesn't continue to repeat itself. Because now this is something that we talk about, and Mary, I know you may have heard me say this probably a gazillion times, if the gazillion is actually a thing, is the fact of trauma, right? But then also generational trauma. There's everyone is affected by violence that happens in our community. No matter what side of town you live on, no matter if you're if you're in Madison, on the outskirts of Madison, we're all affected in one way or another because someone is connected in one at some point to this to probably either that individual or regardless if it's a teacher that's in the school that's in the school district that may have taught that family or whatever. So we're all connected. We are all one big community. And so by us continuing to fundraise and being able to add more people onto our team to be able to approach these different efforts throughout the community as a whole.
Just to get into the weeds a bit with the specifics on these. So in terms of what we're doing now and what we need to be doing, if you look at street outreach, given the estimated population of people at highest risk in the area, we probably need about 5 to 6 street outreach workers and the same number of intensive case managers for the HVIP and a similar number of CBT coaches for the cognitive behavioral therapy. Typically, the cognitive behavioral therapy works best when paired with a transitional jobs program, which is basically a work simulator helping of extremely traumatized group of young men transition from the environment they're currently operating in into a work environment. So if you think you can average that out to about 5 full-time, well-paid, great benefits staff members for those 4. So including admin staff and data analysis and support staff, you're looking at around 25 to 30 full-time staff, as I said, well-paid, etc. Right now, we have 2 part-time outreach workers. So I can't really articulate the vast gulf we have between the current community gun violence prevention infrastructure in the Madison area and where we need to be. Right now, it's as if we have homelessness as a problem, that is affecting our community, and no shelters, and we have essentially 2 part-time staff with a handful of support staff who are addressing it. We are I'll say it one more time. The vast gulf, the lack of violence prevention infrastructure is extreme, and we need to fix that. And so we're going to do our best to handle our part of it. And we're looking forward to working with our partners and the local government to build the rest of it.
And again, to what Nick had just mentioned, as far as how do we get there, intensive outreach with people, that who not only we want to make sure that we're providing financial support to families, but also we have to be able to pay our staff. We want to be able to pay them adequately. Again, this is something that we know has been challenges in our community. And again, and I cannot say this enough, this is our community. And the only way that we can address this, again, is by not only support, but then also by being able to work together on a regular basis. And because we all have different ways, as you can see, even from the lineup of our partners, everyone has their own different way of how we get there. But the thing is that we all agree on that there's a problem in our community and that we want to address it. We want to address it and do something about it and prevent the generational challenges that we all know that can come behind it.
As I mentioned earlier, so we saw the slide prior to this was outlining what an outreach program can do, and we had a story about that earlier with James. This slide is about kind of getting into the community gun violence prevention 101. These facts are kind of key to understanding this issue and what can be done about it. Community gun violence can seem, because it is such a big issue that affects so many people, it's highly lethal. It really affects and is traumatic and horrifying on so many levels. One thing that is really essential to understand about any effective approach to addressing this issue is that the people who are at highest risk of gun violence victimization or perpetration, the people driving the shooters, are a very, 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 very tiny percentage of a given community, right? And this gets into some racial overtones where we know as a country that we assume we have these bias against young Black men being violent. Are the majority of community gun violence victims and perpetrated young Black or Latino men? Yes. That does not mean that the majority of young Black or Latino men are victims or perpetrators of community gun violence. And this is a very simple fact, but it can also, but you know, because of our history and because of our biases, it can be a very difficult one to understand. And when I'm saying this is that it's not, and this is a graphic from Oakland. Oakland did a great job in the past few years reducing their rates of community gun violence. Obviously, they have much higher rates, much bigger population. They cut their numbers in half. And this kind of, what I like about this graphic is it really kind of outlines what I showed you in general. So you have a city with a population of 400,000 people, high rates of shootings, and it's so much. It's just like this kind of gut level, like it just must be 20,000. There must be a significant amount of people who are shooting each other. Really, we're looking at a very tiny fraction of a percent of people who are at highest risk of gun violence victimization or perpetration. So what does that look like in a city of our size? We can't know that without really digging into the data and kind of combining robust predictive analytics with kind of lived experience of people like Coop and people like Jerome, our RH worker, who are really plugged in the community. When you combine these kind of community insight with the data analytics, you can come up with a really accurate picture of who in our community is at highest risk. Or you can think of who in our community is in most crisis and most needs our help and is most likely to pull a trigger or be shot themselves. And then focusing these evidence-based programming on that population. And you have to have that laser focus, both on the population, also on the issue, and then also with the programming that we know works. There's a tendency, I think, a lot of times to just kind of throw things at this issue, which is good, which can be good, depending. It's essential that the programming is focused on this population and that it is based on things that are working and have worked in cities across the country for the past 30 years. Mm-hmm. So that's what this slide is about. The focus, not just on the population, but also on making sure we're doing what works to keep people safe.
Just to even add on to that, as Nick mentioned, the remedies are out there and that are out there. It's a whole thing of making sure that you have the right, that we bring it to our community, but then also we are approaching it and applying it the proper way in our community as well, with the additional partners that are that we have throughout our community. Again, I cannot say it enough, is that not only are we not alone in the work that we're doing, but we know that in order to get the work done, we have to make sure that we're all working together. Period. There's no other way around it. No matter, because at the end of the day, our agenda is to be able to reduce violence that is happening in our community. Yeah.
So I know that I've heard you, and we have discussed this, really basically for as long as I've known you. And do you feel like the people you need involved in this issue with you understand this as well? Do you feel like your partners fully understand and appreciate what it takes and sort of the description you've just laid out?
I would say yes. I think our partners have been around in this community long enough, but then also our partners they're impacted by the violence that's going on in our community as well. Again, this is something, you have to look at it like this. A nurse and hopefully I say this correctly. Nurses understand. So when trauma happens to a hospital, when they come into the ER and they see a trauma victim, that nurse is still impacted, right? They may never knew that person, never knew that person, never had, don't know any type of connections, don't know anything about that person whatsoever. But the fact of from the visual and being able to see the impact that not only affected that person, but also affected the family members behind that person and the people that who may even step into an ER or who could have been at the scene. Again, this is a problem that affects everyone in the community. This is we talk about something, again, I say it all the time, generational trauma, but then also there's also community trauma that happens as well, right? So these are all the things that it's this gumbo, it's this gumbo of trauma that at times some people feel, okay, hey, I'm all right. It doesn't bother. I'm all right. I can get past that. Right. So the folks who we work with, the folks who we've partnered up with, not only do they understand it, they also want to be a part of the solution. So that is why we do what we do, and that's why they do what they do as well, and that's how we're able to partner the way that we are and being able to have those real hard, tough conversations, but with but also being able to bring better action steps to what is going on in our community.
Yeah, and just building on that, and it'll take us into the ecosystem here, is that I think both our partners and the public at large have really understood and that a criminal justice system only approach to violence is akin to an emergency medical system only approach to disease. Mm-hmm. It's ineffective, it's immoral, it's not. And to be clear, MPD, police, they know this and they understand this, and they're very supportive of our efforts in both big and little ways. And so when we think about reimagining public safety, it's really about embracing this and understanding this and implementing this idea, is that we need to have robust, prevention-oriented, restorative-oriented infrastructure that we just don't have. And again, there is a certain amount of creation to be done. There's a certain amount of new things to be implemented, but it really is just about taking things that work, doing them here, and building on it. And we talked a little bit about the ecosystem earlier. These 4 ingredients of the street outreach, HVIPs, cognitive behavioral therapy, and focus deterrence. This is really kind of, for me, what I see this as the building an ecosystem out of these ingredients is really just the beginning, kind of the vanguard of this broader reimagining of how we as a nation do public safety. We have this debate, we've had this for a long time, since the 90s with Cure Violence, and then called Ceasefire, about taking a public health approach to public safety. And there's a lot of reasons for that, and it's really moved the needle, it's really moved us all forward. However, I would argue that we've never had a public safety approach to public safety. We've had a criminal justice system approach, we've had a law enforcement approach, but we've never systematized the value of public safety here. And when we talk about reimagining public safety, when we talk about moving forward, when we talk about building an ecosystem, that's really what we're doing.
Yeah. And just I would just add one small bit to that. In the systems, institutions, and things of that nature, we all know that there are challenges. There have been challenges. There's been targeted communities where people have, we're talking about from drugs to guns, sales, and things of that nature. Those are all things that we know that there are bigger challenges that are out there. And again, with our partners, with partners and community, that is the only way that we're going to be able to overcome those challenges, by being able to work together, period.
in terms of next steps for us, we're not currently a 501c3, but we're aggressively moving towards doing that, which will help us kind of develop our organization and establish the organizational infrastructure that can handle a significant increase in funding and programming, and then continue to work with community partners such as UW Health to implement this evidence-based programming, and hopefully to have, we're very lucky and very fortunate to be working with national partners who provide training and technical assistance to organizations like us across the country, and they are more than generous in lending their support in every way they can to help us implement these proven methods.
So can you say a little bit more about, I mean, you've talked about HVIPs and hospital-based intervention programs, now you're referring to some of the national partners. Can you talk a little more about that? Because I know there are different models of doing that. But in terms of where you want to go and the design you're creating based on being in Madison and, all of the various, there's never one formula, right?
Yeah.
There's, one needs to look at all the resources you have and the partners and where you need emphasis built. So with regard to UW Health and being the level 1 trauma center, that is, as you know, because that's where you go. It is where victims of firearm injuries are taken. So how do you see this, and what are are there still questions about how this should look, and what are they? Where do you feel certain about what it should look like? Because I think it's not never, but it is sometimes, I think it's clear to us, but it's, I think, not always clear in general to people who aren't in this conversation all the time, that there's the community work, there's the work with the organizations and partners that you've mentioned, there's the work that you do inside some of the institutions. So specific then to UW Health and the emergency department and trauma center and trauma floor. Can you talk about how you see the hospital violence intervention program designed?
Sure. I think the questions are really in the details. In terms of what needs to happen and how it needs to happen, very clear, right? We need an outreach program. We need a hospital-based violence intervention program. And then we need some sort of evidence-based combination of cognitive behavioral therapy and transitional jobs program. These are all things we can either implement ourselves or be partners in. And then behind that, you need a broader gun violence reduction strategy, or AKA focused deterrence, implemented by government and law enforcement, which, obviously can only be tangentially related to. In terms of what does this look like on the ground? So with an HVIP is essentially intensive case management for people who have been shot. I mean, and so you can think of outreach as reaching out to people at highest risk and helping them engage in the change process, and then walking with them through the change process. Intensive case management, either for gunshot victims or for people at highest risk who are ready to start making that change. Intensive case management is about providing the supports and resources necessary to help that person. And it could, because a lot of these guys are in crisis in various ways. It could be housing, could be legal stuff, it could be mental health, it could be, childcare, it could be job. There's just a long list of needs that an outreach worker, any one person, is just doesn't have the capacity to address.
Right.
So if you have an outreach worker who's focused on really developing a relationship, helping the person kind of walk through the change process. You have an intensive case manager who's helping take care of all the little big things in people's lives. Could be like getting help, getting a driver's license, getting help, paying for rent, paying off a bit of debt on the credit card, etc. And then you have a program that combines a CBT to help these guys who are really caught up in a very reactive dynamic, to slow down their thinking, be able to take kind of figure out what is a way forward that's best for me and what I want out of my life, combined with income of some kind, because a lot of these guys need that, and the ability to transition from this kind of environment of extremely risky dynamics into a 21st century well-paying job that they can, not just some job that they're going to not ever be able to take care of their family, like a real job that they can build on and have a life here afterward. So what does this look like? It's really about making these three happen in partnership with institutions like UW. Because, for example, when we go after federal funding, the administrative load, the administrative requirements for some of these grants that we need in the funding is immense and would sink us before we even got to the program. We would have to sink a significant amount of our budget just to meet the requirements for this administrative, for the administrative requirements that we just, so the idea, I think the best way forward in terms of community organizations like us partnering with institutions like UW is that these big institutions help to secure that funding and kind of take care of the administrative load while we can focus on what we do best, which is programming and really getting in and helping people. So I think that is the model going forward.
Yeah. Oh, no, and I would definitely agree with everything that Nick just said. And again, as much as Nick eloquently said it, and it sounds really just, hey, okay, this is straight to the point. It's not easy, right? It's not just something that we can just, say, snap our fingers and say, okay, hey, just go ahead and just make this happen. Again, we stood some of the test of time, but then also we know there's still so much more work to do. There's still more partners that we're trying to, that we will be bringing in to be able to do the work that we're doing out in the community, as well as with our staff, trainings and things of that nature. So those are, again, I cannot thank UW enough for helping us and also allowing us to be able to navigate and us having those bold, honest conversations of what it is that we're doing, but then also ways of being able to approach things at the hospital as well. So I want to say thank you.
Well, on behalf of all of our colleagues at UW Health, you're welcome. And I know the first thing most people would say back to you is thank you, because you make people's lives and jobs easier, and you allow them to do the jobs they're there to do, I think they would say as well. And I want to be sure I understood what you just said, because I could have interpreted what you said to mean we should apply for federal grants and hire you, or we should apply for federal grants and embed focused interruption into UW Health. Do you want us to adopt focused interruption as a project within UW Health? Or do you want to be a freestanding nonprofit? Or are these still questions unanswered?
I think right now the detail category.
Okay.
Yeah.
But it's a good argument. No, it's a good question but really it's like, what is the goal here? The goal here is that we implement this proven programming and that we make sure that the people doing that programming are well supported.
Right, exactly.
We're not talking about a $35,000 salary with terrible benefits. We're talking about a well-paid, especially, and I can't kind of push this aspect of it enough, is that you are asking people to engage one of the most horrific aspects of our society on a regular, daily basis. Talking about murder, homicide. The first time you hear a mother crying because they lost their child, you are not the same person. And you have to hear that multiple times, throughout the weeks and months and years. There is no, the trauma that is kind of inherent in this. Plus, we're also hiring people who have a whole history of their own trauma from the same issue. So And I'm kind of going off a little bit tangent, but my point is,
Oh.
what is the goal here? The goal here is that we do this proven programming and we make sure that it's funded to scale and supported and institutionalized so that the people doing it have the supports they need, not only to do their jobs, but to go home to their families at the end and live a life and live a healthy life outside of work, which means that this is not a normal kind of like punch the clock, get in there and come out. Like there has to be a very trauma-informed workplace, which costs money, which costs resources. And that's, so again, that is a detailed question. At the same time, just like what is the goal? How do we achieve this goal together?
That's great.
And I think even just to even kind of even make it more to make it more real for our viewers is the fact that I want to say out of every shooting that you may have heard of that may have happened last year, myself and one of our outreach workers was just about at every single last one of them. Right. So now over the last, I want to say almost just about 5 years, we've been at every single shooting that's happened in the community. Now, when Nick talks about we have our outreach team. Yeah, we're expanding on with our CSWs and doing some additional things. But for our outreach team alone, they've been at every single last shooting that have happened in the community. Now, because we're unable to support the way that we would like to be able to support our team, a lot of times there's been times that I say, you know what, hey, it's okay. I'll go by myself, or I may have someone else there with me if that's possible. Or I had to call onto one of our partners to ask if one of them can come. But again, those are the types of challenges that we're going through right now, and it's not a thing that we're trying to make sure. One, we're trying to make sure that we're getting our teams up to scale. And that's not financially. That's just trying to make sure that we have enough staff to actually be there for the families, for our community. Staff who wants to be there for our community, who wants to be a part of change, who wants to show people you can do something different, who wants to be able to add to someone's life instead of subtracting from someone's life. These are some of the things that these are some of the conversations that what we talk about. But then also this is also, that adds into why we do the work that what we do. We talk about enough is enough. We have to talk about how do we continue to go forward? How do we bring the right infrastructure to what we're doing? But then also making sure that we're supporting the people who want to be out there and risk their lives day to day. Because think about it, there's been times where we've put ourselves in situations that where to be able to support families, there's no vest or no gun. So
we're going to talk. The next slide goes into a bit about what everybody else can do, what people can do, how everyone can step into this work. But I wanted to do a little sidestep here because of some of the things you've been talking about with regard to trauma, vicarious trauma, secondary trauma, what it means to be responding to every shooting in a community. As an advocate outreach worker, trying to help support not only preventing retaliatory violence, but working with the family members and friends and neighbors of people who've been shot or shooters or affected in a million other ways. And the sidestep I wanted to do for a second was to the Dane County Violence Prevention Collaborative. About a year ago, a little more than a year ago, end of March last year, as all of us were changing how we do our work, Anthony, you called me and had made it very clear that you were very anxious about the possibility of an increase in gun violence and the impact of the stress of COVID, all the things none of us could understand or imagine about our futures in COVID, the fact that people were losing their jobs and incomes, the fact that people were home, some with perpetrators of, families were together that didn't have a chance to get away from perpetrators. And I reached out to our various partners and asked if people needed things. And the people who said they did and wanted to talk were the people that became the Dane County Violence Prevention Collaborative. And what you all have in common is you all, as you know, is all of you work 24 hours a day, every day, responding to horrible things that happen to people. Not unlike people in an emergency department. So, we have Rainbow, who is, and all of you moved to a telehealth model within days of having to do that. And how, the pivot that all of you did is just remarkable to me, because nobody missed a beat. You continued to provide services to everyone who you were used to providing them face-to-face, individually. But as we began to talk as a group, what was so apparent is what you just said, is the impact of the trauma that all of your organizations are exposed to on a daily basis, every day, 24 hours a day, 365 days a year, is enormous. And obviously the trauma that is bringing the people you're working with to you is what we're talking about. So I think I just want to raise here, first of all, a thank you to you, because I think it's been a very important thing for this group to be able to meet regularly and support each other in this very strange time when violence was escalating. And it was really hard to figure out how to keep on top of it is one of the things I would say about that. But also to, I think it really forged those relationships in a way that also makes it possible to do some of the things you're talking about here. That it's very clear that all of you, Rainbow, Days, Rape Crisis Center, and you at Focused Interruption, and also UW Health, really are a team that isn't always even aware that you're a team, because you are in many ways working with certainly the same communities and sometimes the same families. And so it's been certainly, as I've said this before, and I truly mean it, a privilege to be a part of these conversations and trying to figure out how to make this all work.
Well, I want to say thank you, Mary, but then also I want to thank you personally, as far as, because I think one of the things is, as far as even bringing in with that collaborative, is the fact that what we did, we took the silos off, right? Mm-hmm. We really said, okay, look, we're going to feed into each other. We're going to have these open conversations. We're going to put things out there. There's been times, there's been tough conversations. But that's how we get to right where we want to go together, right? But that's and again, that's the same approach that what we take in the community, right? We at times have to have hard conversations to get to something better, or even at times of just, and even when things automatically mold together. But the whole thing is we're working with, but when they do mold, we still have to be honest with each other. So we're coming together for the greater good. That is the focus. That's everyone's plan, to say we want to be able to make things happen. So I think, again, it kind of goes back to not only looking at ways how we can support each other, looking at ways how we can ask for support through our community. There's different ways of, definitely, there's always financial support that we need, right? Mm-hmm. But then also, if there are people with your time and talent, we need that as well. Or if there's ways that or even sometimes it can be coffee, or for us to sit down and talk about different ways how are ways that you may have either thought of approaching different situations. But again, something that myself and I talk with Nick and our other team and the rest of our team about is the fact that we're asking to have that engagement, but also we want to be able to, you have to be willing to, there has to be action behind it as well. We want to make sure that there's action that's happening on a regular basis on everything that what we do. We need support. I think that's, I'll make sure as we're winding down, we need support. We need time and talent. We need help with grant writers. We need people who understand the other administrative stuff. And also we are building our board. We just, as of yesterday, we have our main 3 board members, but at times we're going to need other board members as well to come along. Our expectation with the hopes of being able to have 9 at least. So this is again, some of the, not only the support, financial support, but then also time and talent support is definitely needed in what we're doing. But and then also, and at times, even if you want to be able for us to do a presentation in front of other organizations, we are definitely willing to do that. Whether if it's in person or through Zoom, we want, with the hope of people being vaccinated. If not, still we don't mind doing it through Zoom either. So yeah. So I'm trying to think. I think those are the 3 main things.
Can family members and friends reach out to you if they're concerned about a family member or friend? Can people who are afraid that they're going to either be shot or
yes.
commit gun violence reach out to you? And
yes.
And what happens when they do that?
Yep. So if we've been in situations where there's been times when people have said, hey, you know what? I feel like I'm in a bad space, where we're also willing to be able to support and help in those areas as well. I'm in a bad space. Can you remove this? Or can a partner of yours come and remove this or whatever, without there being any other consequences happening to them, which meaning like going to jail and things of that nature. We've been able to work out some of those things as well. So yeah, family members can definitely connect. We're here to support the community. Yeah, so this is, again, you can reach us at www.focusinterruption.org. We do have a Facebook page where our Instagram should be put up pretty soon. This is our address, the 31 South Mill Street, here in Madison, Wisconsin. Again, reach out, feel free. Our office, most of the time, no one's there because we're all out in the community doing some additional work, but emails, we're very responsive. So yeah, so please, if there's any way of either donating or giving time or ways of being able to find ways of additional support, or even meetings that you will that you may want to set up for us to speak at, whether if it's a school, your organization, we are willing to do so. Again, I want to say thank you, UW, and also Fitchburg, the city of Fitchburg, for allowing us to be here with you all this morning.
Thank you both. Nick, last word?
We can do this. We can end gun violence in our community. We can reimagine public safety to create a fairer, safer society. We just need to do what works and build on it.
Yep.
It's great. Thank you both so much. It's a pleasure working with you.
Thank you.